first guest is Dr. Chen, who specializes in the treatment of spinal disorders in both adults and children. His practice is in the city of Orange at the Orthopedic Specialty Institute, and he's here to talk about the latest treatments for back pain, which affects about 80% of the people in the United States. Jack, thanks for coming on Health Matters.
Thank you for having me.
You know, this is a big problem. Everybody has back pain, it seems. And when do we know to see a doctor? When should a patient see an orthopedic doctor, a GP? Can you give us a little guideline on that?
Larry, as you might have mentioned in your introduction, back pain is one of the most common disorders that we are afflicted with. Believe it or not, is actually the second most common reason that people call in sick to work. Really, right next to the common cold. So just because someone has a day or two of severe back pain doesn't necessarily mean you should run to your doctor right away. Okay, we have a lot of muscles in our back, and they're prone to sprains and strains, and so that's most likely the cause of severe back pain.
What would be the warning sign? Well, hey, I need to see a doctor right away.
Well, sometimes back pain can radiate into the legs, and that's one thing that should alert a patient to be a little more concerned. It's also a sign that throws up a red flag for me, because usually if someone has leg pain in addition to their back pain, it may mean that there's some nerve compression. Mm-hmm. As you know, that our back is made up of a network of nerves. It conducts signals from our brain down to our legs, and if there's something pushing on those nerves that go to our legs, you're going to feel leg pain. Excuse me.
What can be done to alleviate that nerve compression in the back?
The most obvious answer to that is sure, there are surgical options to alleviate that nerve compression. But even before we discuss surgery with any of the patients that come to the office, we want to try as many and exhaust all the conservative treatment options that we can first before we talk about surgery. And that may mean options such as epidural injection or physical therapy to relieve the symptoms of that nerve compression.
So epidural injections, you're actually putting some anesthetic right into the spinal
canal, yes, the space for the nerves. When the nerves are compressed, they become inflamed, and inflammation causes pain. So an injection, such as what Larry mentioned, is a combination of anesthetic medicine, just like the same type of medications that you get at the dentist to numb up your teeth, combined with some steroids. And steroids are the best anti-inflammatories that we have. What it does then, if it calms down the inflammation from that nerve compression, it takes away the pain. And once you don't have any pain anymore, that crowding of the nerves really essentially becomes asymptomatic, or you don't feel it.
How often can you get an epidural? I mean, is there a limitation? I mean, once every month?
I tell patients you can really have as many epidurals as you want. If we're talking about treatment of leg pain, an epidural is a treatment option that has been shown in a lot of our literature to help patients prevent surgery. But of course, you know, I think an accepted standard of practice is really to have no more than 3 epidurals within a span of perhaps 2 to 3 months.
Now, the most common one that I've heard is a laminectomy. Is that still a common procedure? And exactly what is it?
A laminectomy really is a surgery that we do to open up the space to the nerves. If you can think about it, our nerves run in a tube, which is the spinal canal. Okay, I always tell patients in the office, think of it as a snake inside of a pipe. And the snake is your spinal cord or your nerves, and the pipe is the space for the nerves. As we get older, we develop bone spurs, or if we get a herniated disc, which is another common thing that you hear. But these disorders, and I can explain that later if we have some more time, but the concept that I want you to understand is that the tube that the snake is in becomes crowded. Okay, so a laminectomy is a simple surgery where we unroof that tube. So sort of making that tube into a U shape, almost like a half pipe, but we take the roof off of that tube, and so the space, the nerves now, where that snake has really limitless room to expand and be free. So that very reliably relieves the patient's leg pain.
I see you've brought some models here on our show.
Right.
Could you please tell us what they're all about?
These are some of the newer devices that have been recently either approved by the FDA or have really gained a lot of popularity in the recent years. I think here to our left here is a model of a disc replacement in the neck. Just as I alluded to, we do fusions in the neck commonly after a decompression procedure. I'll give you a common patient scenario so you can relate. Someone comes in with arm pain and it's due to a disc or the cushion in between the bones. This is an acrylic model of 2 bones, and you can see in between the 2 bones here you have a metal device. Now, naturally, we have cartilage and ligaments which form a cushion in between the two bones. This cushion can break down and push back toward the nerves. If it pushes on the nerves of the arm, you'll get arm pain. So to treat this arm pain, what we can do is to take away the whole disc. And like I had said, when you take away the whole disc, you have to fill the space in between the two bones with something. And the traditional treatment is fusion, which immobilizes these two bones in relation to another. Well, a recent advance has been the fact that we're now able to place a prosthesis, or really two metal pieces that articulate together, very much like a knee replacement or a hip replacement, and that maintains the motion in between the two bones. Instead of fusing the two bones together.
So they're rigid. So these are, you have mobility and flexibility.
Right.
Here.
After our discectomy, where we've already removed the disc, and the preliminary FDA studies, or the studies that we've done comparing patients who are treated with this versus patients who are treated with a traditional fusion, have been very promising.
So this is much more important up in the neck. We need that extra mobility compared to the back, where it's not as...
Compared to the back, I think...
Lower back.
Yes, and the low back, there are also a disc replacement which was approved by the FDA several years ago. The lumbar disc replacement is not as commonly indicated, but that is also a treatment for back pain, which we began to talk about at the beginning of the show. Again, there's very specific indications for it.
That's very exciting. And what is the other device that you have?
Well, this is a model of, you can see again, here's an acrylic model of a spine bone, okay, or a block of bone. You understand in our spinal column is made up of a bunch of bones stacked together, very much as a child stacks a stack of blocks. Our spine is made up of bones stacked up on each other. As we get older and our bones get softer, a very common entity that we see is osteoporosis, which is softening the bone. With the osteoporosis, patients can also have fractures of the bone. And obviously, you would infer, again, that when someone breaks their back, it hurts a lot. It causes a lot of pain. So a treatment that we can do to stabilize the pain from the fracture is to inject cement inside. And you can see these two white pellets of cement that have been injected into the bone. What that does is it stabilizes the fractured pieces together and holds it together so it doesn't hurt as much. Very, very much in the same way that we are able to put a cast on a broken arm to keep those two broken pieces of bone together so it doesn't move so much and cause pain. Now we're able to put an internal cast inside the bone to treat someone's back pain from a fracture.
Is that relatively new, that treatment there?
Yes, it has gained popularity within the last 5 years. 10 years ago, doctors didn't have this sort of an option to treat someone's pain from an osteoporotic fracture.
So there's a whole lot more surgical options now than there were just a few years ago.
Yeah, there are some, but again, I want to make sure that that you understand and the audience understands that prior to surgery, we really try to, again, look at all the other conservative options, treatment options that we can before we move ahead with any of these treatment options that I've shown you today.
We have time for one more question. What would be the #1 thing all of us can do to improve overall back health?
Well, I think a regular exercise would be good, and also good trunk strength, good core strength.
Good core strength.
Something that you would learn from a physical therapist if that's something that you need some help with.
Thanks so much for coming on Health Matters. That was really informative, and it's a whole new world because I know I'm going to need one of these soon. Thanks so much for coming, Jack.